So hello, Steve. Thank you for joining me. So first of all, I would like to ask you maybe a little presentation of yourself, a background, so people can understand who you are, where you're from, and what is your daily practice
Sure.
or weekly practice.
Sure. So, yeah, my name's Steve Denley. I'm a veterinarian in Australia, near Brisbane, and my main work comes from doing rehab for small animals, dogs, about 99% of.
Hmm.
So, my training, I've just finished a rehab course, but previous to that, I'd done it's called animal biomechanical medicine, which is a big course, teaches a lot of palpation and treatment, which centres mainly
Hmm.
on osteopathic and chiropractic treatments. And then I've done an acupuncture course as well. So that I've transitioned from being a regular vet to doing probably, yeah, I still do a small amount of regular medicine, but probably about 95% of it is rehab now.
Okay. And what is your usual patient? Is it a sports dog or any kind
Any
of
kind of
dogs?
dog. We do see. I do see it, some sporting dogs, but that doesn't make up a large percentage. It's probably what
Okay.
a lot of rehab guys see. We see a lot of cruciates, whether conservative management or surgical, and a lot of disc IVDD, a lot of geriatrics, and then
Okay.
helping dogs that aren't recovering from orthopedic surgery, helping dogs that are recovering okay, and helping them, and then some lamenesses that aren't going away with regular veterinary treatment. So that's
Okay.
probably the broad categories of who we treat.
Okay. Okay. So we are here to talk about one case study, or at least one. If you have multiple,
Yep.
that's also good, better.
Yep.
But so obviously you are one of our first user of Tendiboots Canine. So first of all, thank you.
Oh,
It's
cool.
a real pleasure to have accompanied you for almost 1 year and a half now.
Yes.
So can you please let us know what is it? What is the case that you choose? And
Sure.
explain maybe a little bit how the Tendiboots
Yeah.
were helpful for you
Yeah.
in this case.
So I wrote down some notes so I wouldn't forget. So basically, the
Yeah,
dog
yeah.
was it was a female desexed Mastiff cross, 7 years old when it first came to me, and she'd been diagnosed with elbow dysplasia quite young, at 9 months old.
Mm-hmm.
And we saw her in December 22 before I had Tendiboots. And there was the owner wasn't very concerned about lameness, but she's from the horse world, this lady, and so she's on top of body treatments, and she wanted to make sure the dog had reasonable quality of life as it got older, and good mobility. Um, yeah,
Okay.
at the time I didn't really detect any lameness in the dog, but it had the thickened, as particularly left elbow was particularly thickened, and had
Mm-hmm.
reduced flexion of that left elbow. So I didn't focus
Okay.
much on the right side. I mainly focused on the left, and I've changed the way I treat now. If I see it in one elbow, I treat in another. But back then, I
Okay.
just focused on the left elbow, and so at the time, I treated with shockwave. I treated the left elbow,
Mm-hmm.
and this was once again pre-Tendiboots. So I treated left elbow and presumptively left shoulder soft tissue issues, which they often have secondary to elbow dysplasia. And that was fine. Dog, I mean, we didn't have much to measure because we didn't have Tendiboots, but so we're just doing that
Mm-hmm.
preventatively. But then I acquired Tendiboots, and I can't remember if she was one of the first dogs, or I can't remember. Anyway, we said, well, we'll run this new little unit on your dog and have a look. And that was on 15th of February 2024. And surprisingly,
Okay.
when I'm looking at all the figures you give me with Tendiboots, my little brain only focuses on the ground reaction force. So
Okay.
I'm happy you're bringing out the new sort of the bar graphs. I think that will help me just looking at overall pattern.
Mm-hmm.
I realized lameness is a complex, so it isn't just about that ground reaction force. All those other little parameters you guys
Yeah.
measure help, but we still don't. Yeah, trying to figure out which is the lame leg, even when we have or how bad it is. Even when we have Tendiboots, there's still an art.
Hmm.
So, but at the time, and I still do, I look mainly at that ground reaction force when I'm trying to figure out particularly where there's an issue.
Yeah.
And so initially when we treated, this dog had a left fore lameness, but then when I measured with my little unit, GRF on left fore was 34 newtons per kilo, and on right fore was 19.4 newtons per kilo. So we had a lot of offloading of that right fore, and once again, clinically couldn't pick it. I'm not great at reading. I'll do more of it now, but detecting a lameness, even we know from studies, by visually, is difficult. So
Yeah.
there was offloading that right fore. So I said to the owner, look, I should have been watching the right fore, and I offered I had this new device, and I offered just to treat the right fore for nothing, and then I said we'll measure in a month. We'll measure our so we treated
Hmm.
weekly with the
Okay.
shockwave and on that right elbow and the right shoulder, and then we checked again with Tendiboots a month later on the 19th, probably 5 weeks, 19th to the 3rd, 2024.
Okay.
And we had
Okay.
initially, that first measurement, we had 54% difference in the GRF. And then
Hmm.
after our treatment, we had a 24% difference. Still offloading the right fore, but a lot less. So I
Okay.
was satisfied I was making a difference with the shockwave, and I was glad to have something I could measure it with. So so that was a nice little result, and I didn't charge the owner,
Yeah.
and I got what I wanted out of it. So it was quite satisfying as a clinician to sort of have those tools and be able to use them.
And visually, did you
Like I
saw an
said,
improvement
no,
before after,
no,
or is it difficult?
this was a really, as a 7-year-old Mastiff, but she'd had elbow dysplasia, but she'd had the perfect life for a dog with that issue. She swam in the dam. So she had
Okay.
she had good muscle building without high impact. So
Okay. Hmm.
swam continually, had a good life, didn't live in the suburbs, so she lived sort of on acreage and would move around, and so she for just had the best setup for having dodgy bad elbows, and so I think she coped quite well. Dogs,
Hmm.
with similar elbows that were in a bad situation would have been much more lame. So she had really good
Okay.
muscle coverage for a dog with terrible elbows.
Okay.
So no, visually, I didn't pick anything at the start and I didn't pick anything at the end of it, but it just meant Tendiboots. I'm probably going to rely on that more than my eye. Generally, I think all of this lameness and biomechanics, you have to use all
Yeah.
the clues you have. So
Okay.
and sometimes one will get more weighting than the other. But Tendiboots, I don't rely on it entirely, but it's definitely part of my toolkit trying to figure out where the issues and whether I'm getting improvement. So
Yeah. Okay. So this is now part of your daily routine. Do you use it on every dog that comes in,
I
or
don't,
on this
just
few
because of
specific?
time and management of how
Hmm.
the consult will go. Now, I probably, in an ideal world, we will maybe set up with that one day where that just becomes part of what the nurse does at the start. But just in terms of the way the
Okay.
business is run and staffing, I don't do that at the moment because
Okay.
you've got to fit it into your appointment time. So,
Yeah.
and currently I don't charge for it, so I probably should and could. It's just part of
Hmm.
when we run the appointment. So, but the main cases I use it for now would be if I have an agility dog or a sporting dog where we're
Okay.
fine tuning this dog. So so as
Okay.
often if you palpate them, there'll be little things you can find that you want to know how significant it is. So I want more clues as to what I'm trying to fix and help. And so I
Hmm.
tend those guys, I tend to use the Tendiboots every time. So it'll take us 5 or 10 minutes and we'll run it through
Okay.
Tendiboots and just see if there's any issues. And the other guys, the
Okay.
other ones are where I'm just not really sure what's going on, where the owner comes in and say, oh yes, he's been limping on the left fore, and Owners aren't very good at picking lamenesses. They get it unless the dog is holding the leg up. They get it wrong. They
Yeah.
get it wrong quite often from front to back or left to right. And
Yeah.
so I'll use my palpation skills to try and figure out where the issue might be. But and sometimes I'm still not sure, so I'll use those guys where we
Okay.
have a mystery lameness, for want of a better word. I'll use the Tendiboots as part of my clues and part of my decision making process to decide if something's going on.
Yes, as you say, it is part of your toolkit. One tool, more than what you have to try to, and you combine all together, and you follow the path to know what.
Yeah, exactly. And I think of it like a blood test. So as a vet, if I do a blood test, it gives me a clue. It is not an answer; it's a clue. And my hands, they're good. They're better than they used to be at trying to pick up issues, but they're wrong sometimes. And an X-ray it gives you a clue, but it's wrong sometimes because you might see terrible hips. It might have hip dysplasia. But that's not the cause of the lameness. It could be soft tissue stuff or anything like that. So you've got to weight each bit of evidence, and that's how I feel about it. Because like I said, lamenesses are complex. So even if we have a leg that has a higher lift or has a smaller stride, then it may be the problem, but it may not be. You've got to,
maybe this is a cause, and the issue is somewhere else, and it's impacting.
It could be a compensation. And the dog, sometimes they have two issues. So they'll have a foreleg, and that Tendiboots gets really confused by that. But it doesn't matter. It doesn't mean it's wrong. It just helps. It's just you have to be the detective and figure it out.
Yes, exactly. This is exactly what we say. It is not a magic wand. It is just another tool that you.
When I first got it, I thought, this will be great. I won't have to. I'll have more answers, but it just makes it more. It makes it more interesting, makes it more complex, but it makes you appreciate, that lamenesses are tricky.
Yeah, and we improve it, so it is not a magic one, but you try to improve it to help you better and spotlight maybe more quickly what is going wrong. But
appreciate that.
But yet it's still you the professional, and I think it's normal that you should be the one with the knowledge to understand everything.
And I appreciate you guys.
And did you?
I appreciate you guys are trying. You're rolling along and trying to improve the product, and that is, it's very reassuring. And you're using science based to try and figure out issues in lamenesses. So it's great. It's a great product. Value for money in terms of what I get out of it. I'm very happy.
Yeah. Okay. So thank you. And just to finish, did you saw the dog that you talked about recently? Did you saw it recently, or you don't have any news for now?
Regularly for maintenance. I haven't. I sort of haven't. I should probably run it again on Tendiboots. We know where the issues are, so and so it doesn't change. I suppose that's the other reason I might use Tendiboots is if I think because that's the reason you do any test. You want to know, or because you're going to do something different. And we're not at the moment. We don't really need to know, and we don't need to do anything different. So I haven't retested it on Tendiboots, but probably just from an academic point of view, might be interesting to see where it's at. Yeah.
Okay. So thank you for your time and sharing all of this information.
Thanks, Stephen.
Yes, you're welcome.